Hello, everyone, and a very warm welcome to this special interview with Dr. Roshan Koshy Jacob, who is one of the leading medical oncologists in Nagpur. He's currently the consultant for medical oncology at the American Oncology Institute in Nagpur. He's finished his MBBS from the Rajiv Gandhi University of Health Sciences in Bangalore, and then he went on to complete his post-graduation in diabetology from the Johns Hopkins University, the United States. He also has a DM in medical oncology from Bangalore. He's finished with his European Society for Medical Oncology certification exam as well. He is widely known and experienced in various forms of medical oncological procedures. And today we're going to talk about something which is very, very new, relatively speaking, in the field of medical science, and this is known as immunotherapy. So, sir, if you can first help us understand what exactly is immunotherapy.
Yeah, hello, Vinas. Thank you for having me here. So, basically, before going into immunotherapy, I think we need to know what is the immune system, so that we get a more clearer idea of how immunotherapy works. So, what is this immune system? Immune system is nothing but a network of organs and cells which help the body by preventing foreign invasion. It can be either in the form of any infections or it can be in the form of a cancer cell. So normally, whenever there is something abnormal in the body, the immune system takes over and kills those cells. So that is why in a normal person like you or me, the cancer doesn't develop generally. But what happens is that these cancer cells are as intelligent as us. So they just adapt themselves and they find ways to block the immune system. So by blocking the immune system, this immune system is unable to recognize these cancer cells, and they survive and they go on to be to cause cancer. So this is how the immune system and cancer works. So coming to the various, what is immunotherapy? We ask. Immunotherapy is nothing but a form of treatment or form of cancer treatment which deals with improving the immunity of the patient and making the immune system fight against the cancer. So it is quite different from chemotherapy. When we talk about chemotherapy, the conventional chemotherapy is the one which actually kills all the rapidly growing cells. It can be the cancer cells, it can be the normal cells. So because of this, there will be the cancer cells will die. Along with that, a few of the normal cells will die, which actually rapidly divides. These are like the bone marrow cells or the mucosa, the oral mucosal cells, or in the GIT, gastrointestinal tract. These can cause the side effects which we commonly see, like hair loss or diarrhea, vomiting. So in immunotherapy, it is slightly different. Immunotherapy, what are these drugs? What they do is they either boost the immunity or they they take out the block that is there in the immune system, and they will make the immune system work against the cancer.
Right. So does that mean that this particular therapy can be employed for all types of cancers, or would there be limitations to the kind of cancers that it can be more effective in and probably not so much in others?
Yes, Venus. If you want me to list out the sites where immunotherapy works, it will be a long list. I'll just name a few. Basically, if you see in solid cancers, it has been quite effective in lung cancer, in skin cancer, in head and neck cancers, in liver cancer, that is a hepatocellular carcinoma, in kidney cancer, that is a renal cell carcinomas, okay, and even in breast cancer also. So if you see hematological or blood cancers, then almost all the types of lymphomas and acute leukemias, these immunotherapies are being tried, and there are many clinical trials ongoing also in with different types of immunotherapy in these cancers.
Right. So now, if we see the traditional three forms of treatment, if we look at for cancer, which is radiation, chemotherapy, and surgery. Now, chemo is specifically dealing with drugs in that sense, and as I understand from what you're telling me, immunotherapy is likewise. So, what is the primary differentiation, if there is any, between the usage of chemotherapeutic drugs and the usage of immunotherapy drugs?
As I said earlier, Venus, this chemotherapy drugs are the drugs which cause the death of rapidly dividing cells. So these is done by various mechanisms of actions. Basically, in the cell cycle, that is in the cell division, there is a cell cycle. There are various steps in the cell cycle. So each of these drugs act at certain points of the cell cycle, which will stop the cells from dividing and then cause cell death. That is how a chemotherapy works in general. So, but when you come to immunotherapy, when I give a drug which is an immunotherapy drug, it either directly goes and boosts or improves my immunity, which will fight against the cancer, or it will go and take out the block that is causing my immune system not to go and attack the cancer cells. By taking that out, my own immune cells, immunity, that is the B cells, T cells, NK cells, all these cells will go and fight the cancer, and it will go and attack the cancer cells and kill it. So that is the basic difference between a immunotherapy and chemotherapy, if you ask.
Right. So now I understand immunity is it's like a double-edged sword. It can, I mean, if you have more of it, that is a challenge. If you have less of it, that is equally a challenge. So how does immunotherapy drugs play out in this aspect? So are certain patients qualified for this treatment, and will certain patients be disqualified because, let's say, it creates too much immunity in the body?
Yeah. Venus, I think we'll split it into two parts, that question. One is the side effects of immunotherapy. So if you go into the side effects of immunotherapy, it is basically different from that what we see in chemotherapy, which I have already mentioned. So in immunotherapy, the side effects are due to immune overactivation. Basically, you are boosting your immunity, and these immune cells may go and attack your own cells. So this can cause inflammation in your body, in various organs in the body. It can be in the skin, or it can be in the liver, it can be in the lungs, it can be any part of the body. So most commonly we see with side effects, that is, if you ask which is the most common side effect, it is fatigue. Fatigue is most common. It is due to the endocrine organs being affected, or the general fatigue. So fatigue is the most common the side effect that is seen. So other than that, we can have skin rashes, itching is commonly seen, diarrhea is seen, cough and breathlessness if lungs are affected, that these are also seen. But what is important in here is that the side effects are normally, it will be mild to moderate only. Very few patients go into severe symptoms, and most of these symptoms are reversible. And most of the side effects occur a little later. It will not occur immediately once you start on therapy. It will occur a few weeks to few months after the initiation of therapy. So the important part is that most of them are reversible with appropriate intervention at the appropriate time. So that is what is important. In chemotherapy, the side effect profile is totally different, and it is due to the normal cells being killed by the chemotherapy drugs that causes the side effects. So most of the time, what we have observed is that most of the patients do tolerate immunotherapy much better than chemotherapy. And second part of the question, I think you had asked, is
do certain patients, is everybody qualified to undergo immunotherapy?
Correct. So the contraindications for immunotherapy are one thing that you had asked. So if you look into the books, actually they say there are no contraindications for immunotherapy. But actually, if you think over and look, basically any patient with autoimmune diseases that is already, whose immunity is already up, and they are affected by that, like the diseases like rheumatoid arthritis or scleroderma or SLD, lupus. So these kind of diseases, they are already, their immune system is up and it is attacking their own cells. So these kind of patients, if we give immunotherapy, it may end up to be a bigger problem. So these patients, we tend to avoid immunotherapy. And in pregnancy, definitely we don't give immunotherapy. So in certain extremes of age, I think it is said in certain studies to be avoided because the side effects are more common in the extremes of age. But as such, if you look into each drug, they have mentioned clearly that there are no contraindications for these drugs.
Right. And sir, is there borderline, or is there a stage wherein immunotherapy is definitely going to be effective as compared to, let's say, very, very aggressive forms or very, very late stages of cancer wherein maybe immunotherapy might not be as effective? Is there any data for us to look into?
Yeah, see, Venus, any new drug which comes into the market, it goes through various stages. So any new drug which comes will always be tried and tested in the worst subset of patients. That is the metastatic cases, the stage 4 cases, who have already received 2 or 3 lines of chemotherapy and there are no options left. So in these patients, these are tried first. So when they find it to be effective, they bring it higher up, and they bring it to the first line in metastatic. So what you can see when this immunotherapy was introduced in 2007, the pembrolizumab drug was introduced. So it started off like that. It was started off in the worst subset, and in a span of 12 years, now it has come to the adjuvant setting. Adjuvant setting is it has gone beyond the metastatic. It has come higher up. It has come to the adjuvant setting where they have found that in lung, in skin cancers, it has been found in adjuvant setting also. It has been beneficial and it is effective.
Sure. And sir, one factor which is very, very sensitive, especially in developing economies like ours, is the cost factor associated with any form of treatment. So how does immunotherapy stack up against the existing or more traditional forms of treatment vis-a-vis cost?
Yeah, definitely the cost is on the higher side, which we cannot, which is not in our hands. Basically, these drugs are all patented drugs. So only one company manufactures it, and they have kept the rates slightly on the higher side. So if you talk about immune checkpoint inhibitors which are available in India, the rates vary from 1 lakh to 3 lakh per dose, and depending on the drug, it has to be given once in every 2 to 3 weeks. So and it has to be continued till the patient is fine. So what needs to be thought about that in a few years, once the patency is over, the generic drugs may come, and these may be covered in the schemes, and it may reach out to the general public. So till as of then, I think the cost is definitely a constraint.
Right. And is immunotherapy, like we've always heard about cancer treatment, let's say a combination of chemotherapy plus surgery, or a chemotherapy plus radiation, or any of these combinations. So where does immunotherapy fit into this matrix, if we can call it one, or is it a substitute for chemotherapy or a surgery? How does that work?
No, basically it cannot, surgery or radiation cannot be substituted by either chemotherapy or immunotherapy. So all forms of treatment has its own importance in cancer actually. So in metastatic cancer, so whether immunotherapy will be enough alone or whether you need to give along with chemotherapy is depending on certain factors. There are certain tests which we do on the patient's biopsy samples. So basically, there are certain biomarkers called as PD-L1 or tumor mutational burden. So these will give us an idea of whether the immunotherapy, if given alone, will work or whether we need to combine it with chemotherapy. So if the PD-L1 levels in a patient is more than 50% by the testing that is done, then it suggests that immunotherapy alone will work. And in such a scenario, if for example, I say in a lung case, if the PD-L1 level is more than 50% and I give immunotherapy alone and I compare it with another patient whom I give chemotherapy alone, what the studies have found is that the median survival has almost doubled. From 15 months, it has been doubled to 30 months. So that much effective it is in these patients whose biomarkers are on the favorable side. So that we will get to know only by testing.
Right.
So one more important thing that we need to keep in mind is that in immunotherapy, there is something called as pseudoprogression. So what needs to be thought of, unlike chemotherapy, the effect of immunotherapy comes a little slow. In chemotherapy, the results are quite drastic. Like if a patient is responding with one dose of chemotherapy and the patient will say, I'm feeling better. But in immunotherapy, that doesn't happen. Most of the time, it takes a few weeks to months for the patient to feel that there is a change in the symptoms. So what is important is that there is something called pseudo progression where a patient if I do an imaging after 1 or 2 months of immunotherapy, there might be an increase in the lesions or increase in the disease, but the patient may not be symptomatic. So that this is called pseudo progression. This is a commonly seen feature with immunotherapy, which is not seen with chemotherapy. So in such a scenario where patient is not symptomatic and only imaging is showing that there is an increase in disease, we can actually continue with the immunotherapy and repeat the imaging after a period of 2 to 3 months and then take a call. So that is one important thing about immunotherapy.
Right. Sir, I'm sure most patients might have this question when you talk about this form of treatment, about the success or the efficiency or the efficacy of this treatment modality. So what is your general answer to patients who question in this regard?
Yeah, definitely. I think all the patients will have this concern because the amount that is spent is on the higher side. So they will ask how effective is it. So in a metastatic case, what we need to be clear is what we are aiming is for a better quality of life and to prolong survival. So any form of treatment in a metastatic case, our aim is to just as much as possible prolong the life and give a good quality of life. So these two are definitely assured with immunotherapy, depending on the patient characteristics and the lab results. So if the lab results are favorable and if the biomarkers are elevated, then definitely immunotherapy will play a bigger role in these patients. And they are found to be much more effective than chemotherapy with less side effects, which are manageable.
Correct.
So definitely it has to be considered in a metastatic setting. In the adjuvant setting, only in a few diseases it has been found to be effective, or the most of the trials are still ongoing in lung, stage 3 lung, and in stage 3 skin cancers. So again, this immunotherapy has been found to be effective when given in the adjuvant setting, that is post-surgery setting.
Right. Sir, my final question is regarding the future of immunotherapy now. It's relatively, as you mentioned, is a recent advancement. I'm sure data is still getting compiled in many shapes and forms. So how do we look this evolve over the, let's say, next 5-10 years, and how is it likely to impact the space of medical oncology in the days to come?
Definitely, now our hands are tied because of the cost factor. We are unable to give or let all the patients receive immunotherapy because of this constraint. I think over a period of years, as I said, once the generic drugs come into the market, definitely the cost will come down. This has happened with all the other drugs. Even when targeted therapy was introduced, it was very costly. But over a period of time, now it's all affordable. I mean, many patients and many schemes are being able to give the targeted therapy. So I think over a period of 5 to 10 years, definitely, I think it should be able to reach to all the general population. And definitely all the patients will benefit from immunotherapy. And in 5 to 10 years, I think even the data will be more stronger. We'll get more long-term results of the whatever trials has happened, and we'll get more clarity of how effective this immunotherapy is. Definitely, we will get to know more clearly in the coming few years.
Right. Sir, I think that should conclude all the questions that I have. I trust the audience is slightly more informed and aware of this new form of treatment called as immunotherapy. If the audience would like to get in touch with Dr. Roshan, he is available at the American Oncology Institute, Nagpur. You can visit him for a personal consultation, or also do a video consultation, which is available on our website. You can write to us on our email ID or get in touch with us on social media. Sir, thank you so much for taking your time and answering all the questions. I hope you come back again soon on this channel and then speak to us about other topics as well. To all the audience, once again, thank you so much. We'll try and catch you sometime really soon. Until then, take care of your health. For now, it's goodbye and thank you.
Thank you. Thank you.